Dear audience, let me share my progress on my PhD topic, metabolic changes in pancreatic disorders. I'm Mónika Lipp, a PhD student and a gastroenterology resident at Semmelweis University. And my personal vision is to make action and the quality of care. Here you can see on our ongoing project. Firstly, we would like to investigate the effect of fatty pancreas on the risk of pancreatic cancer. Secondly, we try to understand the connection between metabolic syndrome and pancreatic disease progression. And thirdly, we would like to investigate how sodium bicarbonate supplementation plays a role on healthy volunteers. Let me focus on our first project on fatty pancreas and pancreatic carcinoma. It is known that pancreatic cancer takes the first place among asymptomatic cancer. It is also been described that pre-existing metabolic disorders can contribute to the development of pancreatic cancer, and somehow fatty pancreas plays a role in this process. But what is fatty pancreas? Fatty pancreas is a fat infiltration to the pancreas, mostly due to obesity, presented in 30 to 35% of the patients. Our aim was to detect the association between these two entities. We wanted to know if fatty pancreas predispose to the development of pancreatic cancer or not. Our main outcome of interest was the prevalence or the ratio of pancreatic cancer, with the hypothesis that fatty pancreas increases the risk of the development of pancreatic carcinoma. We conducted our systematic search and selection in 3 main databases, with the final search key you can see below. After our systematic search and selection, we ended up with 17 eligible articles for all meta-analysis. And let me present you our results. Here we investigated the presence of pancreatic cancer among patients with fatty pancreas. We wanted to know how many fatty pancreatic patients has pancreatic cancer. We used odds ratio with 95% confidence interval. Cross-sectional and case control, prospective and retrospective studies were included. The odds of having pancreatic cancer among patients with fatty pancreas was 32%, which could be clinically relevant, but not surprisingly, it's mathematically not significant, because fatty pancreas maybe later can progrediate to pancreatic cancer. That's why we changed over the question to see the real connection. And here we were investigated the presence of pancreatic cancer among fatty pancreas among patients with pancreatic cancer. And the probability, it was not just 32%, it was 6 times higher compared to the control group. It's clinically relevant and it is also statistically proven, so the connection is there. Here, we investigated the proportion of fatty pancreas among pancreatic cancer patients. You can see here that the proportion is 62%, which means that you can find fatty pancreas in more than half of the pancreatic cancer patients. Let me focus on our strengths and limitations. We were able to strengthen the connection between fatty pancreas and pancreatic carcinoma on a relatively large patient population. However, we had to deal with some limitation as the heterogeneous patient population and the mostly retrospective nature of the studies. In conclusion, we can say that the probability of having fatty pancreas among pancreatic cancer patients is 6 times higher. The implication for practice is that the measurement of the fatty pancreas should be included in the routine radiological examination, while the implication for research is that more prospective observational studies are needed in this topic. Our manuscript has been published in October in the Journal of Cancer. Let me focus on our second project on metabolic changes and pancreatic disease progression. It has been shown that on admission and peak in-hospital glucose levels are independently and dose-dependently associated with AP severity and mortality. On the right side of the slide, you can see that BMI above 25 increases the risk of severe AP, while BMI above 30 increases the risk of mortality. Our aim was to understand how the different parts of the metabolic syndrome plays a role in pancreatic disease progression on goulash trial patients, where patients admitted with acute pancreatitis and where they followed up in each year. We wanted to know that what are these main factors that contribute to the development, and our main outcome of interest was the ratio of newly developed pancreatic diseases. The clinical implication would be the prevention or the early detection of these metabolic contributing factors. Here you can see our progress. Currently, we are at the statistical analysis plan, and we have some preliminary data from our master sheet, which I can show you today. Here you can see the goulash plus patients' WHO classification of BMI weight status. You can see on the on-admission pie chart that more than 75% of the patients will range in pre-obese or obese classes on admission. And if you see the follow-up years, it's not really changes. And we really would like to know how many of them developed different kind of pancreatic diseases through the years. And let me talk about our third project on sodium bicarbonate supplementation on healthy volunteers. It is known that chronic pancreatitis leads to an irreversible destruction of pancreatic parenchyma. It also results in pH imbalance and exocrine pancreatic insufficiency. The therapy is enzyme replacement therapy. However, I would like to highlight that more than 2/3 of the patients experience steatorrhea-related symptoms, and more than 1/3 of the patients experience malabsorption or weight loss. In a normal pancreas, there is a large amount of sodium bicarbonate production, but in chronic pancreatitis, this function is not working properly. That's why we think that sodium bicarbonate can be potentially effective in reducing malabsorption in chronic pancreatitic patients. We wanted to know that does the sodium bicarbonate supplementation in capsule or in non-capsule form changes the pH in the duodenum or not. And our main outcome of interest would be the alteration of pH in the stomach and the duodenum. And our hypothesis is that sodium bicarbonate in capsule form elevates the pH in the duodenum. Here you can see our methods. We will recruit 20 healthy volunteers. You can see the selection and the exclusion criteria. Basically, we will exclude patients with chronic diseases and patients who has taken an antacid medicine 7 days prior to the study. As you can see here, we will use 4 arms, and we will give different dosages of sodium bicarbonate, and different form of medication should be prescribed. These are like capsule and non-capsule forms, and it varies where it will dissolve. The capsule form will be dissolved in the duodenum, while the non-capsule form will be dissolved in the stomach. As a summary, I would like to emphasize that we have a published paper on fatty pancreas and pancreatic carcinoma. In our second project, we try to understand the metabolic syndrome and how its components contribute to the development of pancreatic diseases. And in our third project, we are focusing on sodium bicarbonate supplementation on healthy volunteers, and we would like to know how it will change the pH in the stomach and in the duodenum. Well done is better than well said, by Benjamin Franklin. Thank you for your attention.
My problem with fatty pancreas, that the definition is for me, I think is not clear and not well known. Yes. What is the definition of fatty pancreas? Is it a percentage made by CT or what?
Yes, normal fat content in the pancreas is 6.2%. So above this volume, it's a fatty pancreas. But in most studies, they used the EUS as a diagnostic method for fatty pancreas. But there isn't a consensus how we should measure fatty pancreas, because it's not an easy process. There is like so many ways to do it, because we should compare the pancreas to another organ, for example, to a spleen, and we should decide, is it a fatty one or is it not. But the gold standard is histology, but we are not able to do a whole pancreatic evaluation. So there isn't a consensus.
And for example, you mentioned the US. Is there any quantitative measurement that can reveal that it's a really fatty pancreas, or just I put a scope and I see that it's a little bit shining, so it's a fatty pancreas? Is any objective numbers or?
Yes. In the studies which I have included, some of them, so they haven't used the same method for evaluating fatty pancreas. Some of them uses that they examined some part of the pancreas called ROI, and they examined of these focus areas, and after they decided if at these focus areas are enough fat content or enough fatty tissue. So they focus on smaller parts, and after that they evaluate these results.